More of the same. Here's our male. We can see our seminal vesicle and obviously the penis here. So let's see what we can see on the outside. We have the skin of the scrotum here. These muscle fibers are your cremaster muscle that are in that scrotum and follow the spermatic cord. You can see the spermatic cord nicely on this model here and here. Spermatic cord is all the stuff that's attached to that testicle as it descends through the inguinal canal, which is here. It's going to go down outside the body and it's going to drag all of those things with it: artery, vein, muscle, skin, superficial coverings, and the vas deferens. And that whole structure together is called the spermatic cord. So here's the shaft of the penis, the glands. This one doesn't have the foreskin, so this is circumcised. You can see the testicular artery here in red. And this blue structure here is actually a separate vein from the testicular vein called the pampiniform plexus. Testicle, epididymis here. You can see your rectus abdominis muscle. This is your vas deferens. You can follow that back through that inguinal canal. Look at this side, you can see urinary bladder. Vas deferens on both sides. These tubes right here going into the bladder are your ureters, left and right ureter. Rectum. On the back of the bladder we have the seminal vesicle. So look at it like this. So here's urinary bladder, seminal vesicle, vas deferens, ureter, prostate gland. Here's your muscles around the rectum. So this is part of that internal anal sphincter. And this muscle right here is part of that levator ani, that pelvic diaphragm, and you can see that here. All right, let's look at this piece on the inside, the sagittal view. Here's the bladder, the detrusor muscle. You can see the trigone on this one, right here. The neck of the bladder, prostatic urethra, ejaculatory duct. Here's your prostate gland. Membranous urethra. Here's your urogenital diaphragm. Deep transverse perineal, sphincter urethrae right around the urethra. Spongy urethra. Here's your corpus spongiosum in blue, corpus cavernosum in white. Bulb of the penis covered by the bulbospongiosus muscle. This is your bulbourethral gland here. Ejaculatory duct again. This is just the very tail end of your seminal vesicle. Rectum. Internal anal sphincter, external anal sphincter. This would be the anus here, the anal canal. Look out here, we can see some more muscles. Again, this is all part of levator ani. Let's see, what else? Oh, I guess this doesn't really show the muscles that I was looking for. I think that's about it on this one. For the layers around the testy, this is your tunica albuginea, the white one, and I believe this pink is supposed to be the tunica vaginalis on this guy. Also, don't forget, when you're looking at these, okay, there's corpus spongiosum, cavernosum, spongy urethra. You can look at these in cross-section, the penis, make sure you can identify those structures. Right here, so 1, 2, 3, just like you'd see under histology. Corpus cavernosum up top, the Mickey Mouse ears, and the corpus spongiosum is the face. And then right in the middle of that you'll have your spongy urethra. Okay, here's another model here. Urinary bladder, rectum, rectum, ureter, vas deferens, urinary bladder, seminal vesicle on the back of the bladder, prostate gland. This is that urogenital diaphragm, so this is deep transverse perineal muscle. These right here are your vessels. Notice here is your bone, your os coxa bone. So your inguinal canal would be right here, which would make this side of this little piece of vessel external iliac artery and vein, because it's in the pelvis. Once it comes through that inguinal canal, however, it is now femoral artery and vein. There's your prostate gland. Look on the inside here. Rectum, anal canal, internal anal sphincter, external anal sphincter, urinary bladder, neck, prostatic urethra, prostate gland, ejaculatory duct, membranous urethra, although it's hard to tell on this one, spongy urethra, corpus spongiosum in red, bulb of the penis here where it ends, corpora cavernosus in purple. You can see the rest of that here. Going down the shaft of the penis, here's the glands. Yeah, the membranous urethra looks better on this side. You can actually see the deep transverse perineal muscle and then the sphincter urethrae right around the urethra. There's your spermatic cord going through the inguinal canal, testes, epididymis, supposed to be testicular artery and vein, and pampiniform plexus kind of all together there. Those muscle fibers are cremaster muscle. Tunica albuginea, tunica vaginalis, scrotal skin. All right, this little male model here has quite a lot of stuff on it, so make sure you spend some time with it because you'll probably see both of these tagged on the practical. Shaft of the penis, glands, no prepuce on this one. Here's a little remnant, so this is circumcised. Spermatic cord coming through that inguinal canal. Here's your testicular artery and your pampiniform plexus. Pampiniform plexus is a vein, it's in blue. Here's your testes, seminiferous tubules inside. Here's your epididymis, head, body, tail. And then sperm would move into the vas deferens, which you can see underneath these arteries and veins here. The layers here, you have your tunica albuginea right next to that seminiferous tubule, tunica vaginalis, and then your scrotal skin and fat. This is cremaster muscle. Notice these vessels here, showing you on either side of the inguinal canal, which is right here. That's your name change. External iliac artery and vein, femoral artery and vein. Bladder, urinary bladder, vas deferens, ureter, external iliac artery and vein, seminal vesicle on the back of the bladder, prostate under the bladder, anal canal. Internal anal sphincter is the closest muscle layer. External anal sphincter is the most lateral muscle layer. All of this muscle in here is part of that levator ani that you learned. If we look at the muscles underneath, now here's the front of the body, this is the back. Here's that triangle that we talked about. So this is the bulb of the penis covered by bulbospongiosis muscle. On the ischium bone, you have your ischiocavernosus muscle, and then coming straight across on both sides, you have your superficial transverse perineal muscle. Now on this model, you can also see an artery, a vein, and a nerve here. Remember, this region is called the pudendum. Pudendum. So this is pudendal nerve and internal pudendal artery and vein, and you can see those over here as well. Pudendal nerve, internal pudendal artery and vein. Transverse perineal muscle here and here. External anal sphincter, bulbospongiosus muscle, ischiocavernosus muscle. And yes, all of these branches are from the pudendal nerve. And then this is skin of the scrotum. Let's open this guy up. Urinary bladder with the detrusor muscle, trigone. Right there on the back of the bladder wall. Again, here's your ureter. That's where it's entering. Bladder neck with your internal urethral sphincter. Prostatic urethra, ejaculatory duct, prostate gland. Here's your urogenital diaphragm. Right next to the urethra is your sphincter urethrae. And then the rest of this muscle here is deep transverse perineal muscle. Bulb, corpus spongiosum, the whole thing in purple. Corpus cavernosa in white and purple. So this would be membranous urethra, spongy urethra. This little guy right here is that bulbourethral gland. Remember, the bulb is covered by that bulbospongiosus muscle. You can kind of see it from both sides. Actually, you can't really see it. This is part of the anal sphincter. But bulbospongiosus muscle is right here. And we saw that underneath. Right here. And what else? And I think that's it for this guy. Let's see. Nothing else really different on here. Prostate, ejaculatory duct, trigone, detrusor, seminal vesicle, ureter, vas deferens coming across the top of the bladder, ureter coming straight down. Really just different views of the same stuff. Here's levator ani. This is your deep transverse perineal muscle, which we saw from the side view here. Same thing. And then this is your sphincter urethrae, part of that urogenital diaphragm, and here you can see it on the side. Make sure you just kind of flip these guys around and look at them from all different views. There's that cross section again. Corpus cavernosum, corpus spongiosum with the spongy urethra.